hit 6:30. So just to start off, I'll just do a quick introduction to myself in case you can't remember who I am. I would have met you all last Thursday. My name's Laura. I work for the Northwest Melbourne Primary Health Network, and I'll be moderating the session tonight. So just a bit of housekeeping. Similar to last week's session, this session will be recorded. So if you could please turn off your camera as well as your microphone. If you have any questions throughout, you can put it in the chat box down the bottom, and we'll come back to it at the end during the Q&A or throughout the presentation if we have time. If you're having any technical difficulties, you can reach out to me through the chat box function and just select the drop down and select my name and send a message through there. So similar to last session, I will be sending a post-survey evaluation into the chat box once the session is completed, and you will need to fill this out. Slides will be made available to you similar to the emails that you would have received from last week. So I think that's all from me. So I'll hand over to you, Clem, to get us underway.
Thanks, Laura. So welcome everybody to the practice level support webinar, increasing the proportion of GP ordered National Bowel Cancer Screening Program kits versus private FOBTs. My name's Clem Byard and I'm a nurse. I've worked at Cancer Council Victoria for about 5 years on the 131120 Cancer Information and Support line. And for the past couple of years, I've also been working mostly in the southeast Melbourne region of Melbourne as part of the prevention area of Cancer Council, looking to increase the number of bowel cancer screening kits that are completed and working directly with general practice. So it's I feel very privileged to have the opportunity to share some of those learnings with you tonight. Before we go on, I'd like to acknowledge the traditional custodians of the land, and that is the Boon Wurrung people of the Kulin Nation for those of us that work at Cancer Council Victoria. And I also pay my respects to their elders past, present, and any Aboriginal people that are joining us today. Just a quick slide showing some of the organisations that are partnered on this project. And I suppose Laura just mentioned that you'll be getting copies of these slides. You'll find that some of the slides are quite information dense, and we know that, but you know, because you're getting copies of the slides, you'll be able to use that to recheck anything that's of particular interest to you. So the sessions build on the clinical group education sessions that were delivered by the VCS Foundation and key partners. And this session is aimed to provide some more practical support in achieving your outcomes. It's broken into 4 parts and each one aligns with these 4 learning outcomes. So looking at the enablers for creating a culturally safe and inclusive environment to support the increase in GP ordered National Bowel Cancer Screening Program test kits. Describe effective strategies to increase the proportion of National Bowel Cancer Screening Program kits. Define roles and responsibilities within your practice team to achieve a whole of practice approach. And identify where you can access evidence-based information, further resources and training to support these endeavours. Now, before we begin, we've got a little interactive quiz, and this is set up to find out how many of you might be encouraging your patients to get National Bowel Cancer Screening Program test kits sent out already, or indeed ordering them for your patients from the National Bowel Cancer Screening Program, and how many would be just sending them to a local pathology provider if they need a bowel screening test kit. So Laura, could you bring that up? Thank you. So that should have come up on all your screens, and That's great. I can see some answers coming in. I'm sure some people attending today are probably maybe administration staff or practice managers, and so it might not be a directly relevant question to them. Okay, we might end the polling and I'll share the results. So there's quite an even spread there of, quite a few people are either accessing kits from the National Bowel Cancer Screening Program and some using local providers. So I guess one of the things is that we really want to encourage people, we can probably take that off the screen now, you can delete that off your own screens. We want to encourage people to put people in touch with the National Bowel Cancer Screening Programs to access kits from the programs for a range of reasons that we'll go into in a little bit more detail in a minute. And up until now, it has been difficult for people to kind of call up and ask for a kit for their patients. So you'd often get put into a queue at the National Bowel Cancer Screening Program. And so it just wasn't very practical to do it. Since they have introduced the portal, it has become much easier, and we'll have a look directly at how to do that. So hopefully once you've had a look at the process for doing it, you'll see how easy it is and how much less time it will take, and it'll make it easier. All right, moving on. So before we dig into it much further, have a little think about what makes up culture, how we see ourselves. Our culture sort of impacts a lot of our daily actions, and some of the things that kind of feed into culture are quite obvious. It could be the way we dress, food we eat, language, and things like that. But some aspects of culture are quite hidden. And as healthcare providers, we might not know much about people's culture unless we ask about them. And these things can include people's attitudes towards screening, and even kind of belief about whether actions that we can take can have an impact on our own health outcomes. So some things that we might take for absolute granted as healthcare workers in a Western medical system might not really be able to be taken for granted with quite a few of our patients. And so that's when we're talking about, culture and making a culturally inclusive practice, that's the sort of thing that we need to think about. Also, I just wanted to raise the topic before we dig too much further into it of why are we focusing on bowel cancer and bowel cancer screening in particular? Well, one of the reasons is that bowel cancer is such a big cause of mortality and morbidity in the Australian population. It's second only to lung cancer in terms of the amount of deaths that it causes, and 1 in 13 people can expect to be diagnosed with bowel cancer in their lives. 93% of those people will be aged over 50. There is some hereditary factor to bowel cancer screening, but most people will not have a kind of recognised family history of bowel cancer when they're diagnosed. And so I think it is a very common cancer. Many people die of it. And even amongst the people who don't die, when people are diagnosed with bowel cancer, it can lead to, very major surgery, long courses of chemotherapy, a long time out of the workplace, a huge amount of trauma to the people themselves, and a huge amount of trauma to their families. Now, one of the good news things about bowel cancer is that when bowel cancer is diagnosed early, actually more than 90% of people will beat it. But the problem at the moment is that less than 50% of bowel cancers are actually diagnosed early. So we know that we've got effective treatment when found early, but it's not found early. And that's where the bowel screening test comes in, the FOBT, that's sent out to everyone in the male every 2 years from age 50 to age 74. It's a very effective test, and if more people did it, we would be able to save a lot of lives. So according to the Australian Institute of Health and Welfare quarterly data for 2018 and 2019, Australia-wide, only 43.8% of people participate in the program. That's eligible people. It's a bit higher in Victoria, up around 46%, but in the northwest Melbourne PHN region, it's actually a bit lower than the Australian average at 43.1%. Now, some of the research has shown that if we could get this rate up from the low to mid 40s up to about 60%, not even 100% participation, if we could get it up to 60%, we would stand to save around 80,000 lives Australia-wide over the next 20 years. So the black dot on the screen represents tens of thousands of people who are having their bowel cancer diagnosed too late and either dying or having, very invasive treatment as a result. So I guess in one way, this is a bit of a call to arms to all of us. It's something that is quite easy and convenient to do, doing a bowel screening test compared to the months of treatment that someone would go through if they're diagnosed. Now, in fact, when people are sent the bowel screening test initially, the first time they get it at age 50, the rate of people doing the test is lower than the overall rate. So only about 1 in 3 people when they first receive a kit in the mail do it. But when people have done it once, this rises to almost 80%. So people who've done the test once find out that it's really not that bad. It's quite easy to do, and they do it, again when it's sent to them 2 years later. And that is it's a real opportunity in that if we can get people to do that initial test kit, they can become basically lifelong screeners. And there's been some research done on the people who do their FOBTs. Why did you choose to do it? And the number one reason that came through that research was because my GP told me to do it. So I think that really speaks to the great trust that Australians have in their GPs and in the people who work with the GPs in primary healthcare. It's a great opportunity. The best way to get people to, convince them that this is a good thing to do for their health, it could be one brief conversation with their GP. GP endorsement is critical, and it has been shown to increase participation by about 19%. So that's the power that's within our hands as healthcare professionals and GPs working in primary care. So we're talking a little bit about, obviously, it's part of a lot of people's practice to give people kits or send them around the corner to a local pathology centre to do a bowel testing kit if someone needs to do a bowel test and they haven't done one. The National Bowel Cancer Screening Program sends these kits out every 2 years. Now, if we can tee people up with the bowel cancer screening program, it's got a bunch of benefits, and one is the follow-up. So if people have positive results, or if the test doesn't work properly, or things like that, once they're, in with the program, they will be followed up, and there are flags to follow them up. So I think that's a very significant reason for, teeing people up with the results. And as I said, one of the main barriers to teeing them up with the results was how long it took to call up the program. Previously, you could only order a kit by calling up and asking for your patient to be sent a kit, or they would have to. now you can log in your own time and request one, you know, much more easily. So, and another factor is that, you know, using the private tests, you know, the private pathology centre tests reduce the reliability of the statistics that we're working with, because those statistics are never matched up with the National Bowel Cancer Screening Register statistics. And also it may include extra costs for the patient. All right, so we'll talk about learning outcome 1 now. Describe the enablers for creating a culturally safe and inclusive environment to support an increase in the proportion of GP-ordered national bowel screening kits. So first, I'd just like to look a little bit more at the details of the screening rates for people who we might describe as lower screen communities. So Australians who speak a language other than English at home, you can see there that even though the rate overall is fairly low for people who speak English as a first language at home, it is significantly lower for people who speak a language other than English. And the rates are even worse for people who identify as Aboriginal or Torres Strait Islander. So again, these statistics are coming from the Australian Institute of Health and Welfare. I guess there's a range of groups that are in lower screened language other than English: Australian and Torres Strait Islander, Australians with disabilities, Australians who live in remote areas, and Australians from lower socioeconomic areas. All of those people are at increased risk of missing out on screening, essentially. I think one thing that we can do, though, is take that as an opportunity, because it means that when we're interacting with people from those groups, the chances are higher that those people are currently unscreened or underscreened. And so the chances are higher that our interactions with them are going to have a positive result in boosting the screening. I'd now like to talk a little bit about some of the barriers that are there for the different cultural groups. So culturally and linguistically diverse groups, often people have come from countries where there is no screening, and so they may lack a knowledge of the benefits of cancer screening. There can be cultural perceptions and taboos about cancer that means that people are very reluctant to speak it, and that can actually be a barrier to them getting access to screening, which could save their life. Language and literacy issues are obviously a big factor. I don't know if any of you have actually seen the forms that come out with the bowel screening kits, but they're about 4 pages long, and I think they would be quite intimidating for someone who has limited English language skills. And that's probably another opportunity for, say, nurses who are working in general practice, may be able to help people complete the paperwork. If people don't fill those forms out correctly, if they don't put the GP's details on those forms, then you may never find out as their GP if they've screened positive. I suppose there is, for some people coming from other cultures and other countries, there can be a lack of trust in healthcare providers or government programs based on events in their own countries. Look, this is really just touching the surface of some of these barriers, and there is much more information about these things on a Cancer Council Victoria website, which is called the Cancer Screening Hub. And it drills down, it gives resources to help interact with these communities and lots more information. So I'd really encourage people to look at the Cancer Screening Hub. Some of the barriers for Aboriginal and Torres Strait Islander, again, pardon me, there can be distrust of healthcare providers and government. And this can come out of previous negative experiences with healthcare providers, or it can come out of, experience of the stolen generations. There's some overlap between the different groups here. I suppose Aboriginal and Torres Strait Islanders have a strong sense of the group and of family, and this is obviously a wonderful thing for many of them, but it also means that sometimes people prioritise their family or community needs over their individual needs, and they can neglect their own health for that reason, and maybe not do screening. Now, I think just one moment, please. Sorry for that. I was just about to get timed out of my my internet connection there. So another thing is that there can be a lack of cultural sensitivity in the way that healthcare is provided. So sometimes if Aboriginal and Torres Strait Islander people come into a practice and they see evidence that this is a culturally safe place, that could be through signage, resources that are displayed, posters, or it could actually be if they're asked about their Aboriginality, that is a signal to them that this is a culturally safe place. And those things can help promote screening. Again, we see here on the screen one of the resources from the Cancer Screening Hub. That's Bob's story, and this is one of a range of resources that are there for helping interact with people who've got disabilities. So quite often, if people are, people maybe don't think to follow up about cancer screening with people who've got kind of severe disabilities or various disabilities because they've got all these other pressing health needs that compete with the need for cancer screening. And that means that people can be excluded from this really important health access. So sometimes with the patient's permission, you might be able to interact with the patient's carer to help facilitate cancer screening for people with disabilities. So I just want to talk about a few enablers that help overcome these barriers. One that's really important is proactively raising these topics of screening, especially with people, from under-screened communities. Very often there's shame, there's fear about cancer, there's fear about what the outcome of screening might be. And people, for all these reasons, will not raise the topic of conversation with their GP or with their healthcare provider. And that means that it falls to us to raise the topic with them proactively. It's a good idea to ask permission before discussing potentially sensitive topics. Not take for granted the knowledge. So it's, you might need to explain some things that you think people should already know, the importance of screening. Normalising screening, the fact that, increasingly, it's something that everyone does when they reach a certain age. Having a demonstration kit there available so that you can actually show people what's involved in using the kit can be really powerful, especially if people don't have great English language skills. Flagging that the bowel screening kit will come ahead of time so it doesn't kind of come as a surprise. Often people, when they get unregistered mail, just put it straight in the bin. So letting people know, hey, you're 49. Next year you're going to be getting a bowel testing kit. Do it, open it, it's important. And having policies at the practice that support equitable access to screening. And there's a few here that are may be more specific to individual groups. As I said, asking people about their Aboriginal and Torres Strait Islander, for some staff, this can seem confronting. But for many Aboriginal and Torres Strait Islander people, that is a signal that this is a safe and inclusive place. Displaying posters and brochures, displaying an Aboriginal flag in the waiting room can be positive. And because people from some of these cultural groups have different ways of communicating and different ways of understanding the world, if you're able to provide some cultural diversity training for staff, that can be very powerful as well. There are lots of resources that are available that are targeted to these specific groups. So there with the people with disability, you can see easy English, simplified English, pictorial, audio versions of things, braille versions of things. These things are available if you know where to look for them. And the cancer screening hub's a great place to start. There's some other enablers there for culturally and linguistically diverse. I'm just conscious of the time, and I know that you're going to get copies of these slides, so I might push on here. So learning outcome 2, describe effective strategies to increase the proportion of bowel cancer screening and GP audit kits from the National Bowel Cancer Screening to private FOBT. So we're going to talk now a little bit about the specific strategies that we can use. So one of the first things, if we're going to, design a strategy to increase the number of people in the practice, the number of patients of the practice who are participating in the National Bowel Cancer Screening Program, is to get a good idea of who's eligible, how many of your patients are eligible, and how many of them have already screened. So then you'll know which patients to target. So there are recipes that are already available for the software that you use in your practices, where you'll be able to kind of get a breakdown of these patients. So using things like PenCat or Polar or things like that, you can target filters against age 50 to 57. The various codes for FOBT, search on active patients only, and then pull these reports. And there's further detailed support available for these activities from the PHN if you require it. So this is a little look at the actual National Cancer Screening Register's health provider portal. So now the cervical screening register and the bowel screening register have been combined into the National Cancer Screening Register, and they now have this online portal. I'm sure that a number of you have probably already got access to this, and I think it's part of this project that everyone will need to get access to it. And look, it's just a fantastic time saver for accessing information, updating your patient's details, ordering further tests and things like that. So once you've kind of worked out which of your patients, from your own software are eligible, you can kind of double check their status. Have they done their tests or not through the online portal? You'll need to create a access login. That's the PRODA or the provider access login. When you access the website, you'll find that there are some really clear step-by-step walkthroughs that make it really easy to follow these steps. We've now got a short video, which is just the introduction to the online portal in case you haven't seen it yet.
The National Cancer Screening Register has introduced an online healthcare provider portal.
I'm sorry, we seem to be having a slight glitch there. Just bear with me for one moment.
The National Cancer Screening Register has introduced an online healthcare provider portal, providing a new way to access the register's information and services. The Healthcare Provider Portal allows healthcare providers and practice staff to more easily access patients' bowel and cervical screening data, ensure their screening remains up to date, and to submit program forms to support improved patient cancer screening outcomes. The portal can be accessed through the National Cancer Screening Register and PRODA websites. To securely access the portal, you will need a PRODA account. PRODA, or Provider Digital Access, is an online identity verification and authentication system used to enable secure access to government online services. The Healthcare Provider Portal enables you to access your patient's bowel and cervical screening information online, fill in and submit forms online, removing the need to print, scan and fax to the register, manage your patient's participation in the screening programs, and order a free replacement bowel screening test kit directly to your patient's address. The National Cancer Screening Register's Healthcare Provider Portal supports better patient care by allowing you to access your patient's bowel and cervical program-related data at any time. For more information on the register or the portal, visit ncsr.gov.au.
So I know that this online portal is something that a lot of people have been asking for and looking forward to for quite a while. So the fact that it's now available is a wonderful thing. Another interesting point about the portal is that it is able to connect directly to practices software, so the software that's used by your clinic. According to the website, best practice has been integrated with the portal since January this year, and I think it said that medical director is still a work in progress and coming soon. So here's a little look at the dashboard where you could kind of look at one of your patients' screening histories and status and things like that. And just I've highlighted in red there where the form section is. So in order to order a new kit for your patient, so this would be if, you know, one of your patients has had a kit and not done it, you know, maybe they put it in the bin, or, you know, maybe it's they've left it sitting there and it's now expired, or they opened it and didn't know how to use it and, you know, have sort of spoiled it or lost it or anything like that. If you need to order a replacement kit, then you can go to Forms and select Replacement FOBT kit, fill out that form, and a new one will be sent out to the patient's address on their Medicare address. So I suppose the provisos on this are, one, that if you had a patient who needed more frequent screening than the 2-yearly National Bowel Cancer Screening, you couldn't order extra kits. So this would still be, they would still get kits at 50, 52, 54. You couldn't order extra kits on off years. And also you would not be able to order kits for people who are less, you know, under the age of 50 or over the age of 74. But they're the two main provisos on ordering more kits. So when you've identified the patients of the practice that are eligible for the National Bowel Cancer Screening Program and haven't yet been screened or no results have been, then you can kind of potentially target them by some communication. Now, there's a range of ways you can do this. You could do it proactively by sending out emails to them or SMS reminders. And there are templates available that you could use or modify to your own requirements. So there on the screen you can see is a template of a letter, and that's available. You can find the link to that in the resources at the end of the slideshow, or also through the Cancer Council Victoria Cancer Hub website. There is another resource which is called GoShare. This is a subscription service that the primary healthcare network has already subscribed to, so you have access to this, and this is a way of sending a mass kind of communication to a whole bunch of people at once, and you could add in a variety of different things. So you could add in some resources that were specific to a particular cultural group. You could add in a video, you could add in a fact sheet, you could add in various different things according to what you wanted, and a custom message for yourself, and then send it to a whole bunch of your patients at one go. So that's a powerful tool, and I'd really encourage you to all have a look at that as well. This is just to flag to you one of the pieces of research into a range of the different interventions. So this was across a range of different cancer screening and a range of different ways of interacting with patients, and that's in the references as well. So opportunistic conversations about screening. This is a particularly powerful one. It's one that probably doesn't take a lot of extra time and effort on clinicians' behalf, but when you have a patient in who's in the right age of screening, it's an opportunity to ask them, have you done it? Did you receive it? And encourage them to do it, and just explain to them why it's such a powerful thing to be able to do the FOBT kit. If people are coming in and they're 49, if they come in for a 49-year-old health check, you can flag to them, you're going to be getting, one of these in the mail, shortly after your next birthday. Do it. It could save your life. So those opportunistic conversations are they're little effort, but if they, if you know that the patient's in the right age frame, just add that in as a little bit extra to whatever they've come in to see you about. Another thing that can be done is adding a flag on people's files or records, so that, hey, we know this person's coming in, we know they're in the age range, or we know even that they haven't done a test, we haven't logged any results for them. Bring it up with them when they're next in. So the third learning outcome is looking at defining the roles and responsibilities of the general practice team to achieve a whole of practice approach to increase the proportion of kits. And we're going to do another set of little quizzes online to, I suppose, get some ideas from you guys as to what you think you might be able to do according to your various roles within the practice, what you could do as a GP, what you could do as a practice manager, what you could do as a practice nurse or non-medical staff in the practice to increase screening in the practice. So Laura, could we have the next of the quizzes, please? All right, so everyone can have a look here and see which of these things look like the sort of thing that as part of your role, you might be able to do to create a kind of culturally safe and inclusive practice. That's great. We've got some results coming through now. All right, that's maybe enough results there. So I'll just share these results with you. every practice is going to be slightly different in the way that it's set up and what roles and responsibilities fall to the different members of staff, but just, you know, taking a proactive approach to identifying what 1, 2, or 3 things might I be able to do in my role. Could I put flags on patients' records when they're coming in? Could I, you know, go onto the Cancer Council Victoria website or the Cancer Screening Hub and order some resources, which are free of charge, of course, free resources that we could put in the waiting room. All right, so I'll move on to the next poll now. Sorry, Laura, you can click off that one and Laura will share the next one. So this time, based on your role in the practice, how would you use the National Cancer Screening Registry Healthcare Provider Portal? So this is how might you be able to use the portal. I think another, you know, important thing, so it's not just GPs that can use the portal. People can have delegated ability to use the portal on behalf. So if you want the administrative staff in the practice or the practice nurses to be able to go in and update patient information or, you know, follow through on other functions, they can set up logins too. All right, I'll share the results of this poll again. So that means that you'll be able to do a lot of these kind of functions in your own time. You know, instead of having to, at a peak period, wait on the line to get results for an individual patient or something like that, you can click in at a time that's convenient to you to get the information that you need. Great. All right, and we'll go on to the final one of these polls now. Thanks, Laura. So based on your role in the practice, how would you include opportunistic screening or opportunistic conversations about screening in your role to increase the number of national bowel cancer screening kits ordered? Now, of course, you're not limited to these options. These are just putting some options in your mind as possible things that you could do. That's great. I think we've got enough results there, Laura. So I'll share these results again with you. So this is just a little snapshot, a few ideas. In the following slides, we've got some much more detailed information, and I won't go through it in, you know, exhaustive detail, but you know, they are there for you to look at when you get copies of the slides to kind of go through and see which might be useful for you in developing a plan for your practice. Great. All right, you can click out of that one now, everyone. So having a whole of practice approach and bringing everyone in is important because we don't want the efforts of some of the staff being undermined by others. You know, other staff in the practice who are not quite across the plan. And so that might involve having a dedicated person, a champion, if you like, or a sponsor of the project, having meetings, getting together and looking that everyone knows what they're doing to kind of achieve the goal and, you know, keeping track of, I suppose, results, improvements in the screening rate and seeing how the strategy is working. So this is a little shot here of the Cancer Screening Quality Improvement Toolkit. This has been put together in collaboration with 3 of the public health networks, including Northwestern Melbourne, and it has got lots of kind of great information in it about developing the plan. You know, ways of kind of promoting it through the practice and things like that. So I think this is a real guide to all the detailed knowledge that you need to create that plan and achieve the results that you're looking to achieve. We've put together a few questions here about, that you might want to check back across once you've created the plan or seeing how you're going to make sure that you're across everything. Do the team members know their roles and responsibilities? Do staff have sufficient knowledge of the bowel cancer screening program to be able to promote it, to effectively be able to advocate to patients why they should be doing it and why they should be promoting it? Are staff, initiating the conversation or just waiting for patients to bring the conversation up with them? It's worth thinking about whether staff have got sufficient training, or do staff feel confident about having these discussions with people from under-screened communities. Are you displaying bowel cancer screening material in the practice? All right, so these are the kind of more detailed slides that I was talking about, looking at things that people in the different roles within the practice, so practice manager and admin, GPs, and also practice nurses. As I said, we won't go through that in great detail tonight, just in keeping with time and wanting to keep some time available for questions at the end, but these will all be supplied to you so you can go through them in more detail. So the fourth learning outcome is around further information, resources, and training. So the Cancer Screening Hub, as I said, is probably the first one that I'd be visiting. It's just got a great range of information about each of the cancer screening under-screened communities and resources that are specific to those communities. So here's a little breakdown of what you might see when you went into the cancer screening communities. If you click on it, it'll give you some background about it and then take you through to the resources that are available. Here's a little snapshot of some of the resources that are available for Aboriginal and Torres Strait Islander community. Some of these are available from the Cancer Screening Hub. There is also a separate website that has that is called Indigenous Bowel Cancer Screening, and the specific references at the end of these slides, and that has things like videos where you could share that with Aboriginal and Torres Strait Islander patients to give them further information about bowel cancer screening. Resources for linguistically and culturally diverse communities. So this is just a tiny snapshot really of what's available. There are resources, brochures and posters and things like that that are available in lots of the non-English language, non-English languages that are spoken in the community, and again available through the Cancer Screening Hub. The actual National Bowel Cancer Screening Program website is also a really good place to get further resources from. So you can see here they have some resources that are targeted specifically at Aboriginal and Torres Strait Islander patients. And there's also a really good kind of animated video. I've just put a still of it there on the screen, but that is a really good little short video that you could show to people, which takes them through step by step how to do the actual screening test. The Health Pathways Melbourne website is probably one I think most of you would be well aware of already. So it's a great hub for getting a really wide range of information, far beyond cancer screening, but it also links you in with other screening resources. One of the screening resources that it links to, which is also available directly from the Cancer Council Victoria website, are optimal care pathways. So optimal care pathways is basically, it's a little breakdown of what best practice for different cancer types is like when it comes to screening, when it comes to diagnosis, when it comes to the actual treatment of cancer and everything. So the full optimal care pathways are largish documents, I would say 60 to 80 pages long, but on each of them, you might struggle to see it there, but on each of them there is a quick reference guide, which is basically a summary of the full document in about a 2-page thing. So I find these so useful if I want to look up, how long before a, kind of test should people be, starting treatment for this kind of cancer, or it's got lots of that sort of information. As you can see there, they started rolling out in about 2014, and they're still rolling out now. So they're not available for every single kind of cancer, but all of the big kinds are there. There is also what is called the What to Expect guides. So these are short documents like the summary documents, but these are in language that is very accessible for patients. So this is something that you could print out and give to a patient. It's just a 2-page simple English explanation of what to expect about a certain type of cancer. And this is another thing that has sprung out of those optimal care pathways. They're called the iPaste cards. They're available in print on card forms, so you could keep a folder of them near your desk at work if you wanted to, or they're available online. And basically they're targeted really at general practitioners with information about diagnosing specific types of cancer, referral pathways. And as you can see on this one, it's got a nice graphic there, which shows, for every 100,000 people who have a FOBT, how many people will die, how many people will have adverse effects. For every 100,000 people that have no screening, what is the chance of dying of bowel cancer? For every 100,000 people who have a colonoscopy without having had an FOBT first. So it's just a way of you could pull out one of these cards and have a really clear conversation with a patient. Say if a patient came in and said, I'd like to be referred for a colonoscopy because that's the gold standard, even though they didn't have any symptoms and even though they hadn't done an FOBT. Well, you could pull this out and say, well, look, this is the, rate of, adverse, events for people having colonoscopies. So we might recommend an FOBT first in your instance, or different conversations like that. It just facilitates those conversations. Now, the National Cancer Control Policy, this is actually the Cancer Council Australia website rather than the Cancer Council Victoria website. I just want to draw attention to this because this has got lots of the good technical information. So if you want to know, how accurate are the bowel cancer tests, what is the evidence that underpins the program and things like that, this is where you can get that information from. And again, the links to all of these resources are available at the end of the slides. And I've just put a few other good ones here. There's another video from Queensland Health. There's some more research into the role of primary care, and this is the research that I was sort of quoting a bit earlier in the presentation. And on the Cancer Council Victoria website, again, some frequently asked questions, which I think are, that's another great thing just to kind of get those things that you might need to know. Here's the links to all of the resources that I've discussed, so you're able to access them. Just some acknowledgements of all the people that have contributed to this important work, and thanks to them. And now just wondering whether